Sewa Akoto is a critical care nurse at the East Hospital. She's worried the team of doctors and nurses at the ICU are getting overwhelmed by the rising cases of COVID-19. Madam Akoto tells my colleague Matilda Gavi that caring for COVID-19 patients requires painstaking, difficult procedures which can subject the entire healthcare system to serious stress.
It's a room of excited critical nurses at the East Hospital. 4 of them are getting ready to enter the ICU. Sewa Akoto is getting ready for the day's task. Inside the changing room, she is helped by other colleagues to don PPE. Wearing these protective things alone can take about 10 minutes. It's a careful, thorough process that largely saves the frontline workers from getting infected. Sewa heads for the high dependency unit. Being in this room is like hanging off a cliff. The fear of death, pain, and anxiety fill every inch of this room. There are 4 patients in dire need of help from Sewa and her colleagues. It is Sewa's turn for the 4 days, 12-hour shift. A shift that becomes strenuous when you are dealing with COVID-19. The more critically ill the patient is, the closer nurses cooperate with doctors in providing life support treatments.
Yeah, what we do is most of them, we manage their symptoms as they come. Some of them come with a low oxygen level, some come as low as 64%, the one that I showed you. So we put them on oxygen, we give them high flow oxygen, we try to give them up, and some of them to manage their symptoms. Some come with comorbidities like diabetes and other things, so we try to manage those conditions as well. So it's a whole kind of thing. It's not just one specific thing, yeah.
Sewa moves from one patient to the other, checking monitors. Occasionally, she speaks to the patients who only nod or give thumbs up as response since they are all on ventilators. 2 of her patients are restless. 1 is gasping for air. Another nurse reaches out to one of the patients and carefully adjusts the pillows, while 2 other nurses make a dash for the oxygen cylinders. There are different life-saving activities going on at the same time. Other nurses and a doctor monitor the activities in here through a window.
So they stand outside with all our plan inside. So if we are supposed to do anything, like say give this medication, they communicate to us. We ask them, you tell them the vital signs, write this out. They're supposed to give this, and they tell us. And sometimes when you are doing something, they see from outside. They will prompt you. This thing has gone off. Can you do something about it? Okay. That's what basically they do. Okay. Yeah, that's what we all do. Okay. And then once we go in, we are not here all the time. We do come in as time is needed. So we will standing outside and then monitoring them from at the back of the window.
The nurses leave nothing to chance, as one of them for close to 20 minutes holds an oxygen mask to the face of a patient while the oxygen is being fixed. What are you doing?
He's on oxygen, and then the system has gone down. Okay. So I'm just maintaining it, the level, so that he can take it.
So that he can become stable?
Yeah. So when they bring the other cylinder, then you can put him on it. Okay. The system, this is a central oxygen system. Okay. Yeah. Okay. And the system is down. So you can see here, it's written low oxygen flow. So they are now working on it for the system to respond, and then it will be normal. Okay.
They are confined to the steaming PPE. The only break is to lean against the wall or squat briefly in between the checks.
And we are overwhelmed with the rise of COVID cases now.
Help by masking up so the cases can be reduced.
Let's try and observe the safety protocol. Health workers are overwhelmed now. We are breaking our back, so please try as much as possible to do as you are told. Mask up, wash your hands. Observe the safety protocols. Help us to help you. And you can see our staff strength, we are not enough. You see, we had a challenge with the oxygen now, and most of us had to dawn in. I had dawn in the morning and gone out around 12. I had to come in again. You see, I'm panting. Even as I'm talking, you can see that I'm not really in there, just moving about. So there's a lot to be done. And I don't know, the public is not, some of them think that COVID is not real, we are exaggerating, but no, COVID is real. There's a lot of cases here, we do lose some of them. So it's better to be in the comfort of your home than being in an ICU.
The long hours, the stress and anxiety that comes with treating COVID-19 patients are affecting them. Because for Sewa and her colleagues, every day at work means a fruitful exposure to the disease that has killed some of their patients.
It's really affected us psychologically. Coming to work every morning, we work for 12 continuous hours for 4 days. You take 3 days off, and you are called at any time to attend to an emergency. Being a critical care nurse, you are called at any time to attend to emergencies. And so for us coming to work 12 hours, leave your family at home and come and work, and sometimes when you come, you nurse a patient, the next morning you come and the patient is no more there. It's like you've done a lot to save a life, but then the life is gone. So we are really going through a lot emotionally. We are breaking our backs. It's really affecting us a lot.
For a medic who combines administrative and clinical works like Dr. Joe Mensah, the past 2 weeks haven't been easy for his family.
Well, it's been difficult, not just for me, but for my colleagues as well. We're running longer shifts. We're running more days because of the numbers we're seeing. And for my family, I understand it's been difficult. My wife, my kids. Unfortunately, I couldn't even take my kid to school when he reopened. Because I've spent the past 2 weeks, I've practically been here every day. And for some of my colleagues, it's been the same story. We are pushed to the wall, but then we need to offer the services to our clients. So we're doing this for God, we're doing this for country and for our patients.
Psychologically, is it having a toll on you?
Yes, it's been stressful. It's been stressful. I have an appointment actually with my clinical psychologist. I should have had it yesterday. Hopefully I'll have it today because it's been stressful. She thought I should come see her for a session. And it's important that the public know that COVID is real. A lot of people still do not believe there's COVID until it comes right to your doorstep. It affects a relative. But then do not wait to that point when you unfortunately lose a family member. COVID is real. For corporate organizations who have been supporting us, yes, we need some PPs, but we also need some toiletries to support the patients we see, food items, etc. are all welcome. So if you have any support for the fight against COVID, we are always welcome. The infectious disease center is also open. And for both facilities, we're doing our best in the fight against COVID. Come and support us. Come on board.
Sure. The Ghana Registered Nurses and Midwives Association recently reported that 4 nurses have lost their lives since the pandemic broke. 840 have also been infected. The nurses are calling for insurance packages for those infected. They also want government to reinstate the incentive packages for nurses, as some of them are yet to receive the 50% allowance announced by government since the onset of the pandemic. For JoyNews, Matilda Gavi, Ga East Hospital.